Have you ever pondered over the intricate realm of veterinary medicine, especially viral ailment known as lumpy skin disease, or LSD that affects livestock such as the cow we observe here? We delved into the causative agent, risk factors, and diagnosis of LSD. However, today we are going to explore more deeply into the clinical pathology of this disease in our laboratory. LSD can be propagated using wounds, and many PCR tests can identify the viral antigen. The virus's DNA can be found in the skin for up to 90 days after infection using PCR, which is significantly longer than virus isolation. Additionally, an antigen ELISA has been applied on samples obtained early in the disease, before the emergence of antibodies, which become ineffective. Identification of capropox viruses in skin scrapings or biopsies will be made using electron microscopy. Consideration should be given to the history of generalized nodular skin disease. Capropox can be distinguished from parapox virus, which causes bovine papular stomatitis and pseudocowpox. But it shares physical similarities with viruses that cause cowpox and vaccinia. Histopathology of the lesions shows a granulomatous reaction in the hypodermis and dermis, exhibiting early lesions intracellular eosinophilic inclusion bodies. The most accurate serological test is to neutralize the virus. Indirect fluorescent antibody and agar gel immunodiffusion (HID) tests are less accurate due to cross-reaction with viruses causing pseudocowpox and bovine papular stomatitis, which could result in false positive results. Post-mortem findings may reveal similar lesions in the intestines, esophagus, trachea, skeletal muscle, and bronchi. Pneumonia may also occur. Usually, lymph nodes on the skin are enlarged. Respiratory distress, often in combination with aspiration pneumonia, resulting from necrotic ulcers and surrounding inflammation in the upper respiratory tract, often results in breathing difficulties and death. Histologically, a widespread vasculitis indicates viral tropism for endothelial cells. Intracytoplasmic viral inclusion bodies have been reported in various cell types. For confirmation of diagnosis, samples include histopathology, skin, alimentary and respiratory organs, lymph nodes, LN from formalin-fixed lesions. Virology, lymph node, skin lesion, ISO-EM, antigen detection, affected organs, blood, semen, PCR antigen ELISA. While there's no specific treatment, antibiotics or sulfonamides are recommended to prevent subsequent infections. Control of nodular skin disease mainly involves limiting the movement of sick livestock, although it can also be spread by airborne vectors. After entering a new area, there's a likelihood of further spread of the virus by insect vectors. And ticks have been associated with the maintenance of the virus between epidemics. Limiting livestock movement from unaffected to affected areas is a key step in preventing the onset of the virus. Once in an area, vaccination acts as a control. The most commonly used vaccines are commercially available and freeze-dried live attenuated. Because of antigenic similarity in capropox virus, vaccination against attenuated sheeppox virus is used to protect cattle from LSD virus infection. Other viruses included in potential vaccination options against all capropox infections are those that can infect sheep, goats, and cattle. At the onset of an outbreak, herd vaccination is not very effective. Most animals will already be affected by the disease, so in these circumstances, the disease can spread from improper needle hygiene. Thank you for taking the time to understand more about this complex disease. Veterinary medicine is a field full of intricacies and complexities, and diseases like LSD are just one part of the bigger picture. Stay tuned for more insights into the fascinating world of veterinary medicine.